Alright, live on YouTube.
I think it was Justin that asked me what the lipo was. Welcome everybody from YouTube. We are in the middle of doing some lipo. We're going to do a BBL. She wants to give her curves, and boy, she's going to get some curves. Doc, Laura. Woo! 'Cause this is vaser. What it's doing is liquefying the fat so that it's not as traumatic to be removed, less bruising, less pain. This is going to come out like a straw, like a liquid. One minute blank. Just coming out as a liquid instead of as sort of grape-like clusters. Okay, now we're going to do the upper back rolls. We did request that she do Renuvion. She did not accept that, so we'll do the best we can with the vaser for the rolls. Another thing we've been doing for the rolls is Morpheus, or microneedling. So you get vaser, Renuvion, lipo, and then microneedling for the skin. So we'll show you that at some point. Doc, Thursday is the new doctor. Cover 3, Abigail. Thursday, new doctor, cover 3. Another one, Ryan. I'm hoping Dr. Rocket likes us, we like him, and he moves here. Dude.
I like him.
Yeah, he seems very chill.
We love you, Dr. Rocket! Dr. Rocket is a Houston plastic surgeon that we found through local tenants. He's going to start operating 2 days a week here.
Yeah. You guys vibe real well then?
Huh?
You guys vibe real well? Vibe real well?
Oh, we vibe, yes.
Yeah.
He was super bright. He was in the MIT Harvard program. Actually was an aerospace engineer for NASA. Worked on the space station projects and stuff. Not as an astronaut. Flies planes.
Building his own plane though.
He had his own Piper Cub, right?
He's building it in his garage.
He's building his own plane?
Yes. Ultralight?
I don't know.
Not ultralight, he's actually trying to build like something like one of those small Piper kind of
He's trying to build an airplane.
an actual plane.
He's an engineer.
An actual plane. Yeah.
So then he did plastic surgery as a second one.
We get that guy.
Real bright. So he was in this MIT program, and they accept 8 people into Harvard Med School automatically because you're an MIT. So he got one of the 8 spots, but due to family issues, he had to leave to come to Houston, and it went to UTMB. I'm like, It is what?
Bit of a step down.
I say, but he did the right thing, you know, for his family. But what a brain.
Education is what you make it. So,
Yeah.
it's nice to have great mentors.
Anyway, Abigail, if you want to write that thing for him today at some point, what we can put on the website about him?
Yeah.
Dr. Rocket, and I'll get the trademark going.
Okay. Yeah, I'm just gonna kind of cut it and put it together and put it up on the website.
We'll just call it intent to use, or at least if you get it up, I'll say it's already up on the website. Dr. Rock.
Oh, okay. Like a
ROC.
dash?
Yeah, I think so.
Okay.
Right? Instead of Dr. Rocket without a dash. Maybe Dr. Rocket exclamation point. Should I do that one?
Yeah.
I know nobody's gonna have that.
Yeah.
Nobody adds an
Probably not.
I mean, they're gonna do the search for me.
Look, yeah.
But still, I would put them up as soon as possible so Rudy can.
Yeah.
And also, he'll need to give us some pictures of his work, pre and post for a page for him.
Yeah.
Some of his VNAs. 1 minute. Got it. This great machinery, first in German made, better than micro air. It has 10 millimeter surface area. The biggest micro air does is 5, so then we do this. The biggest one on the market. And this is going to harvest fat into this container. What's great about this system is we don't have to take the fat out and take the water out. We just reinfuse it quickly. So the biggest part of BBLs is the lipo. It only takes me 3 minutes per butt to reinfuse it. Back in the old day, you take 10 cc's in a syringe, and you put think about 500 cc's, that's 50 syringes, or 50 movements. This is not like that.
A lot of extra trauma.
No, just it's time consuming.
Yeah.
Think about 50 syringes per butt. Here, I handed some of it. And then the syringe is clogged. Highly inefficient. This we're just going to reverse this. Put it back in the buttock.
Seen a lot of new innovations like this for the more specific procedures.
Oh yeah, when I see something, I usually get it. It's going to reduce our time.
Yeah.
Because another, be easy on the patient.
Thanks for watching.
How's your recovery after one of these?
It varies. Depends on the patient's pain tolerance.
See a lot of bounce
And
back.
blood loss, starting hemoglobin. Patient specific, really. Some people look great at 1 week and happy moving. Some people take a little bit longer to recover from the blood loss. I usually say 3 to 4 weeks on everyone. Some people surprise me, most are around that. 300, doc, upper ab. So this machinery here is very you're in the splash zone. Sure.
Yeah. So I can dodge a ball, I can dodge a block, right?
Yeah.
Yeah. paint's pretty easy to control for these guys though.
Yeah, I mean, only a few have requested more than one refill. So we do one with like 30 or 40 pills initial. I'd say 10% ask for refills.
Not too bad.
I mean, we tell them ahead of time it's going to hurt. Lower is Doc 300. Yeah, I don't think very few people have. Once they start getting a lot of pain, I'm like, I'm going to the pain doctor.
Yeah.
It's out of my wheelhouse. Obviously, we screen for people who are already on pain meds. So those are really difficult. Because your liver is revved up. You know, cytochrome P450s are revved up to chew out the pain med, right? To metabolize it. If you go on multiple like gabapentin and stuff, you start like, who's going to manage your pain? Well, you are. Well, here's the contract, the pain contract. You get one refill. Based on that, you agree to see a pain doctor.
And it's good policy.
Huh?
Great policy.
Yeah, I tell people I'm basic. I'll go 5 through 25, one refill.
Do you have a volume target, or do you go by feel?
Feel. I kind of know how much things are supposed to do. I get surprised sometimes. Yeah, right now I'm just kind of knowing that you need about an inch so they don't get divots.
Yeah.
This has already been worked on here though from the scar, so from experience at this point, I feel I kind of know the bulkiness has gone down. So it takes you 11 to 15 years. And then it takes you another 20 years like me. It takes you 31 years to be at this level. A residency in practice. The old expression, it takes you 10 years to be a plastic surgeon after you're done. It's true. For me, I think 20 is a sweet spot. I know a lot more than I did. So how old are you?
38.
If you want to go the surgeon route, you're going to be like 52. I mean, that's old to start.
Yeah, second career for me anyway.
Yeah, so 52 means you got to work till 80.
Maybe not.
Hopefully not.
Well, you know,
Because you have residency. That's for surgeon, basic and general surgeon, you're going to do 5 to 6, 2 years in the lab, 4 years to 3 years of plastic. You get the integrated, and you'll do a 3 and 3, that's 6. Assuming you get in at age 40, that's 46. I'm 52. And you find a guy that will help you. Or work for a corporation for a while. Doc, that is blank is 400. To build a practice from scratch now is really difficult. Let's see what it takes. See how many people work here? 37 now, right?
big office.
Big office.
And growing.
Now it'll be close to 45 with the third service center.
You're full of two more surgeons plus more support staff. We got the third surgery center opening up.
Yep. A lot going on, man.
exciting time. You still love being here.
I like it. It's like a spaceship. Dr. K and I, we have lots of good talks together. Him and I are best friends.
It's
kind of like you go to work, man, you're with your friends. 150 number. He drives 8 hours a week to be here. From Houston.
Coming from Houston?
Come from Houston every week.
I thought you moved over here.
That's how much
I like this truck, dude. Oh, wow, man.
No, dude. He drives from here. I told him start taking planes, dude. I gotta keep your back, dude. I said, twice a month take a plane. Poor guy drives 4 hours.
Every weekend. They get a little crash pad out here.
First we had him off on Mondays. And he's like, okay, I need Mondays. I'm like, you sure? That means you leave Friday and you leave Sunday. You're literally
Every week.
I don't know how he does it. I'd be just flying on his
Then again, think my daily commute here is a 1 minute walk.
He walks 1 minute. So like he doesn't commute all week. And when he goes to Stone Oak for Christmas, he'll have like a 2-minute commute on surface road.
That's not so bad. It's evening it out.
It kind of evens out, less frustration. And then when he goes on Fridays, he lives midday usually. It works out. I think the frustration, daily frustration is removed from his life. As far as driving and aggravation.
I'm working in a hospital.
Oh yeah, by the way, hospital sucks. Got all these suits walking around. What are they doing? What's this guy doing?
Driving up the bill.
Weekly meetings, every week you gotta meet, med exec, you gotta meet this committee, that committee. Life is much easier there.
Elon Musk and Steve Jobs have a 15-minute limit on meetings.
You get bothered. Can't get it done in 15 minutes, you're not prepared for it, right?
How many things take more than 15 minutes, really?
Yeah, so he comes in every week. I just can't believe it. But he has ASA 1 patient now. They're healthy. Dude, when he goes and does other things, he sends me pictures of him in line. COVID-19 gown with half-dead people. Hey doc, let's just sneak this one in now. Half red and kidney failure.
You won't believe how many times I've read that.
What?
We can do it, come on, Doc.
Come on, doc, we can do it. You can do it, doc. Come on.
20 minutes. Come on.
Like now, today, it's like, no, I'm gonna lose 5 figures today. But here we all have the same mindset. Always remember the Hippocratic Oath. Once you go through a few bits of traumatic experiences in an OR, you're like, my threshold's real low. Can't answer anything. Do no harm. I rely on them a lot. Sometimes I'll see a patient pre-op and he's here and I'll say, hey, what are you okay? You're cool with this?
Yeah.
Oh yeah, I like it. You can do fine. I'll do it. Do an interview. My side, we're just doing your breast talk. I'm like, do you mind doing this? That's a good thing to have with your providers. Because they'll know a lot, man. They'll know more than, what's really dangerous about this procedure. Blood loss, not really, because they're healthy. It's the anesthesia.
Makes sense.
Coming up on 3 years, we've had 0 complications.
3 years, 0 complications.
We trusted 1 or 2. An AFib, something I could control. We just didn't like the way they looked post-op. It was control. Control, like, oh, okay, not doing good, not going to hotel. We looked at each other. We've only disagreed once because we decided to test our limits. Both of us. And we learned that now we're like, when we see something like that, we're like, going to the hospital. Let's go. To recover. And you know what, when you do that, people admit for me, and they know me, same group of people, and they give them blood, they fix them up, and then they let them go. You know, I did this. These are things you learn, man. You don't learn it the first few years. I'm accelerating your learning curve. But I told him he's going to be 46 before he's a surgeon.
Yeah, if you go through your residency, right?
And those first, like, 5 years, you're in the hole. From 52, I'm not pushing against it, but damn.
Yeah. If you love it, you're gonna do what you love. You have to just drive and the desire.
Well, remember, you have to retire with a certain amount in your bank account.
I want to retire with 0. Burned up and used up.
Not a good strategy, but
Not the greatest strategy, but we, you know, whatever you decide.
I don't have kids.
Shit happens, man. If you're in
if you
life.
don't have kids, you're rich. You don't need a lot of money if you don't have kids.
Now I got cheap hobbies too.
What are your hobbies? Do you have any expensive hobbies?
Yeah, I play guitar, but I
500?
Got it?
No,
That's not expensive. That's not expensive.
It can get expensive.
Did I do vaser on this song?
You did? You collect, are you collecting like certain kind of guitars or anything like that?
Yeah, I have 15 now. One of them, the 1937 Rickenbacker Model B lap steel, which I restored. But I built most of mine now. So I'll put $400 or $500 for the parts, make a custom wiring harness, dial it in the way I want it, and sometimes I replace
What kind of music do you play? Like rock music or what do you play?
psychedelic. Is probably closest, but I do when I play acoustic stuff. I do a lot of like singer-songwriter junk. Some Texas country I've gotten into the last couple of years.
You're gonna have to perform for us now.
200,
You can't say that.
a 150 upper back.
Got it.
Thank you guys. Gonna flip. Have y'all take some pictures, and we'll be right back.
Thank you so much, everybody.
You can't tell us that and not play for us. You gotta
Let's come out to the house.
Christmas party. You're bringing the guitar, man. You're gonna bring the guitar.